Tuberculosis, TB, is a contagious bacterial infection caused primarily by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs, but it can also spread to other parts of the body, such as the brain, kidneys, and spine. TB is one of the oldest known human diseases and has been a significant public health concern for centuries. TB is primarily transmitted through the air when an infected person coughs, sneezes, talks, or even sings. People nearby can inhale the bacteria and become infected. However, not everyone who is exposed to the bacteria will develop active TB disease. Some individuals develop a latent TB infection, where the bacteria are present but not causing active illness. Symptoms of active TB disease can vary and may include persistent cough, sometimes with blood, chest pain, fatigue, weight loss, fever, and night sweats. In cases where the infection spreads to other parts of the body, symptoms can be different based on the affected area. Diagnosis of TB. TB can be diagnosed through a combination of tests, including skin tests, such as the MAN2 test, blood tests, chest x-rays, and sputum samples for bacterial analysis. Molecular techniques like the polymerase chain reaction, PCR, are also used to detect the presence of the bacteria's genetic material. Treatment. Active TB is treatable with a combination of antibiotics, usually over a period of 6 to 9 months. The most common drugs used include isoniazid, rifampin, pyrazinamide, and ethambutol. Multidrug-resistant TB (MDR-TB) and extensively drug-resistant TB (XDR-TB) are more challenging to treat due to resistance to multiple drugs. Prevention. TB can be prevented through a combination of strategies, including vaccination, with the Bacillus calmette-guerin or BCG vaccine, identifying and treating latent infections, ensuring good ventilation in living spaces, and promoting proper respiratory hygiene to reduce the spread of bacteria. Global impact. TB remains a major global health problem, particularly in resource-limited settings. It is a leading cause of death worldwide, especially among people with weakened immune systems, such as those living with HIV/AIDS. Drug resistance. The rise of drug-resistant strains of TB has added complexity to its management. Drug-resistant TB is more difficult and expensive to treat and requires longer treatment regimens with more potent medications. At the end, a very important point, HIV co-infection. TB and HIV/AIDS often coexist, as both diseases weaken the immune system. This makes individuals with HIV more susceptible to developing active TB and also increases the complexity of treatment.